Hello, I'm veterinarian Dr. Kerry Fling, and welcome back to the East Lake Pet Talk podcast. And today, joining us in the studio, I'm here with Kerry Franklin. Welcome, Kerry.
Thank you.
And Lula Bell. And Lula Bell is no stranger to our studio here. She's actually visited us before, and she is an East Lake Pet Orphanage little rescue dog. And her story was that she was found in a house that was left abandoned by its inhabitants, and she was left behind in the house with no food or no water. And the whole idea that she was even found and survived, as tiny as she is, without starving or dying of dehydration in itself is a miracle. But here today we're celebrating another miracle, and that is we're almost to the 6-week recovery point after her big surgery. So, and if anybody's been following Lula Bell's story, Lula Bell has had a condition on both rear legs that was a birth defect condition called luxating patellas. And with the luxating patella problem, basically what it is, and I'll show you on this leg over here, which is the leg that actually had the surgery, she had a problem where her little kneecap was slipping toward the middle or medially, and that was causing her leg to freeze up and lock up. And then what was done to correct her problem was that the groove that houses the patella or the kneecap was actually deepened, and then the insertion of the patellar tendon that was too far toward the middle was moved to the outside, moved laterally, and secured there, and then the joint capsule secured to really offer better support to that knee. And so how have things been since her surgery?
Oh my goodness, she's like a new dog. When we first got her, since both of her back legs had problems, she couldn't stand up. So she would scooch around like a crab, and her mobility was limited. Since she's had this surgery, the back leg can stand straight up.
And so she's had the surgery done just on the right leg.
Yes, and so her hips, now she stands up like a dog, as you can see she's doing. And it's gotten so strong that now she can prance and run, chase birds,
and that was pretty hard for her to do before, because I remember watching her, and she would actually flip up and do a handstand and support her entire weight on her front legs as she walked, just because her back legs were so dysfunctional. So that's pretty exciting. So she's got 3 strong legs now, not even 6 weeks post-op. And I know you said that what she wanted for Christmas and the New Year was to have a second leg surgery.
That's what she wants Santa to bring her. She's been a very good girl.
Oh, she has been. She's been a perfect girl. And if you'd like to help support Lula Bell's surgery on the opposite leg to help her have 4 strong legs, you can certainly make a donation to helppets.net, and we'll share that link with you here. And that way you can help fund her surgery. And the cost for this type of surgery can range anywhere from $3,000 to $5,000 sometimes, depending on what aspects of the surgery need to be done. Typically it's a 3-part surgery, but sometimes there are actually other surgeries that need to be done to the upper leg bone in particular for a successful outcome. But we're blessed to be working with a great local surgeon here, Dr. Bob Radash, who has graciously donated a good portion of his time to help her. But even so, with that, her medical expenses are fairly costly. So please help Lula Bell get her second surgery. And again, helppets.net is the way to do that. And so let's take a little break here, and we'll watch Lula Bell walk around and see how she does. But I think she's doing fabulously. So we'll go ahead and take a break, and then we'll come back in just a bit.
See how she'll like swing that bad leg back, like do something.
Could you be any cuter? Let's go for a walkie walk.
What are you doing? You're confusing me.
Well, there you have it. Very amazing to see that progress. And I loved your description, describing how she was like a little crab before she had the surgery done. And now to see her so strong on 3 legs is just truly amazing. But tell me a little more about how the recovery process was. I know this was certainly very emotional to go through this big of a surgery for such a tiny dog, because how much does she weigh?
Like 3.5 pounds.
3.5 pounds. And well, tell me about that whole process for you.
I was very reluctant to go through with it. I felt like her size, she was so tiny. I didn't want her in pain. I imagined lots of pain, long recovery. So I wasn't really too excited about it, but it has been amazing. We picked her up. We dropped her off on a Wednesday, and we picked her up the next day. And when we did, her little head popped out of her little crate, and she had a little cast on, but she was alert. She seemed so happy. She got home. The cast stayed on for like a week, 10 days. She did have to wear a cone, but she was happy.
And you felt like her pain was well controlled?
Oh, very much so, very much so. I could tell she wasn't lethargic, she wasn't laying around. In fact, if anything, we had to try and keep her from trying to run around and be excited about it. And each week, she got better and better. I would say really even after just 2 weeks, she was wanting to stand on it. We had to have limited range, but she wanted to take off and go, and so the whole experience was so much better than what I envisioned. And
so with other pet owners facing a diagnosis of luxating patella, would you recommend?
Go for it. Yes, absolutely. It's been a life changer for her. She can run and have fun and chase squirrels and
even on 3 legs.
Yeah, even on 3 legs, she's doing great. So I would absolutely put your thoughts aside and do it.
Well, she certainly has been a wonderful success story for having this procedure done, and we're so glad she's doing this well. And the good news is, by her having these surgeries done, even though this condition was very physically disabling, it was not so much a painful procedure or a painful medical condition at this point, but over time, if she had not had the surgery done, she would have really developed some bad arthritis in her knees and a lot of other problems down the road. So hopefully you're protecting her joint health for the long term to have had the procedure done. And again, if you do want to help Lula Bell have her second surgery, you can do that by logging on at helppets.net, and we can certainly help her get that other procedure done that she so desperately needs. One lucky girl, and lucky to have you helping her too.
I think it's all my luck for her.
Well, thank you so much for joining us today, and we'll take another break here, but we'll be back in just a moment with more of Eastlake Pet Talk podcast. Thanks so much. Hello and welcome back to the Eastlake Pet Talk podcast. And how about that little Lula Bell?
Such an amazing story, just to see how really deformed her legs were to begin with, and just the miracle that is the surgery that they were able to pull off.
Absolutely. And I loved Kerry's description of how she walked like a little crab.
Very cute, fuzzy crab. But
yeah.
It's good, good that we've had those days over now.
Oh, I know. And so it'll be so great to see her get through with that last surgery on the opposite leg, and it'll be great to have that behind her.
Yeah, we'll keep you all updated as well on her progress.
Indeed. And if you would like to help Lula Bell with her second surgery, don't forget to log on to helppets.net. And as we put these links out there, don't worry if you missed jotting them down. They'll be in our written description to where you can look any of these links up, any of the ones that we discuss here on the show. And we mentioned previously, too, that we have a phone number where people can reach us. What is that phone number now, Dr. McCauley?
That's right. We have a dedicated phone line. It's 972-808 6038. And more good news, we're actually now on iTunes. It's a lot easier for some people to download these podcasts via iTunes, via their app. So you can go and either find a link in the description below the, at the bottom of the show, or you can go and search actually on iTunes for Eastlake Pet Talk Podcast. Our episodes will be up there. So if that's an easier way to get the podcast, we recommend you go to that.
Great. And as always, we do want to cover the topics that you're most interested in having us cover. And whether you live right here in Dallas, where we're based, or whether you're anywhere in the country, we're happy to try to help you. And many people already know Dr. McCauley and I, but for those of you who don't, we're both small animal practitioners. But I always say no day is ever boring, because we take care of anything from little chihuahuas like Lula Bell to an occasional goat or pot-bellied pig, reptiles, rodents, you name it, dogs and cats. That's what we're here for.
Tons of wildlife as well. We actually have a lot of wildlife brought into us. We mentioned the Chinese pheasant that was there a few weeks ago.
Beautiful bird.
We have wild birds brought in all the time that we like to work on and see if we can help.
Yeah, we actually had a little whippoorwill that somebody brought in too, which was kind of fun. And it's crazy because we put a little posting out online about this little whippoorwill, and I think people were so excited to see this whippoorwill because they are nocturnal birds. And so actually this bird was rescued. I think it was asleep, and these are ground-dwelling birds, so I think somebody scooped it up, rescued it, and brought it to us. But it gave us a neat little opportunity to get some cool video footage of a nocturnal bird that we don't usually get to see. And, gosh, there are thousands of people that have logged on to see that fun little video. So
great.
We love doing anything that celebrates all kinds of critters, dogs, cats, wildlife, you name it. That's what we're here for.
If you do have any specific questions, we always do recommend that you send them to us by email. You can reach us at podcast@welovepets.net. We welcome questions on dogs, cats, birds, pigs, goats, what have you.
Absolutely.
We'll do our best to answer them.
Well, and one of the things we talked about last week was leptospirosis, and I really enjoyed getting to visit with you and Dr. McCauley, Dr. Pennington. I enjoyed visiting with you, too.
Me too.
But Dr. Pennington, who had that interesting case of leptospirosis that she was working with, and I thought it was interesting that she brought up the point that a preventable disease like leptospirosis can be managed with a $20 vaccine, whereas the intensive hospitalization to treat something like that, at least in the patient's case she was talking about, ranged up to around $2,000. So
100 times the cost of a vaccine to actually treat the disease and all the worry and mental anguish and problems that come with that. So
absolutely,
it's way better to prevent.
And just a reminder, leptospirosis is a bacterial organism, and in fact, it's a spirochete organism. And I think we can show you what that looks like here.
Such a cool video.
Oh, yes, it is. And it's kind of an odd corkscrew sort of organism. And in fact, syphilis is in the same family as leptospirosis. The two don't have anything to do with each other, and you aren't going to get syphilis if you get lepto, but I don't think you want either one of these bugs. No spirochetes. Yeah. Yep. And leptospirosis has risen to be the #1 cause of acute kidney failure in dogs. And again, I think the points you covered about how communicable it is, how it spreads from animals, pets, wildlife to people, that is so very, very scary. And again, it's a preventable condition with vaccine for our dogs. So
I know last week Dr. Pennington talked about just how the hospitalization did take 2 days and cost $2,000. Now, I don't want people to think that the dog is just sitting there in the hospital, being observed. That includes IV fluids, multiple blood tests, antibiotics, anti-nausea medication, a lot of upkeep, a lot of supportive therapy going on while we do this treatment. And so it's not just that we're charging an ungodly amount to have the dog sit there in a cage. It is a lot of supportive therapy.
Intensive.
It's an ICU. It really is.
Yeah, ICU sort of therapy. Yeah, and that's not something you want to go through for your pet or for yourself, either one. So this is a great example of how preventative care with vaccination can protect your pets and your family. So if you're not sure if your pet has the leptospirosis vaccine, definitely talk to your pet's doctor, or if there are questions about that, you can reach us at Eastlake directly. And you can call us at 214-342-3600. 3100 to find out more information about the vaccine itself or if your pets are current. But if you do see another veterinarian for your veterinary needs, please call them and ask them, because it's not always part of the core vaccines, depending on where you're located. It is something that we address locally here just because it's endemic in our region. But a lot of people don't really realize how common this problem is. So best to prevent. And I think you said an ounce of prevention is worth a pound of cure.
Always.
Yes.
I'm very sure of that.
Yes, definitely true. Well, on to other topics. I wanted to also mention that after visiting last week about traveling with my son's cat, Mr. Butters, kind of got me to thinking about traveling. And I think one of the big reasons that a lot of people don't bring, especially their dogs, to go traveling is motion sickness. Have you had that complaint a lot?
Absolutely. It's a real thing. People, don't just, I guess, figure that animals can get motion sickness or car ride sickness just like people can, but they do. We see it a lot, and it can really ruin a trip.
Right, it can indeed, and traveling with a pet can be such an incredibly bonding experience, and it can really be a lot of fun, even with cats. And I was astounded that with our cat that it went as well as it did. But for dogs in particular, I think they're probably even more prone to motion sickness sometimes than cats are. And there's a neat product that's called Cerenia. And Cerenia is actually the first FDA-approved product for use in dogs that will prevent motion sickness. And statistics say that 1 out of every 5 dogs is prone to motion sickness. And I think so often people don't even talk to us about those sort of problems. So if your pet does have motion sickness troubles, ask your pet's doctor about Cerenia. The way this product works is it actually interrupts the motion sickness center. It's part of a pathway, like a neurologic pathway that originates
centrally in the brain. Instead of trying to do anything in the stomach or the intestines, it actually goes to the central nausea or vomiting center in the brain and blocks that signal that I'm getting sick because of this movement. And people may not notice or may not understand what signs of nausea and vomiting are. Well, I understand vomiting, but nausea in dogs can be everything from hypersalivation, so they'll get very
start
very
drooling.
Very drooly. They'll sometimes become very lethargic. They don't want to move at all.
Or just anxiety. Sometimes
anxious.
if they're anxious, that is a sign. Or licking their lips.
Yep, licking the lips.
That can be another sign of nausea. So any of those things can be a sign that we really need to intervene and help that dog deal with the stress of motion. And the thing that I think is so neat about Cerenia is that because it targets that pathway that you're talking about, it doesn't cause sedation. And some of the old medications that we used to use were more sedative type products. And so the great thing is by doing this medication a couple of hours before travel, it's working in their system. It lasts for up to 24 hours, and you don't have a hangover or sedative sort of effect. So you and your dog are ready to go and enjoy life to its fullest wherever you wind up going on your transition and your transport.
Yeah, forget the doggy Dramamine. This is the new medicine to use.
Yeah, the new medicine. So really a good thing. And so if there are questions, certainly ask your pet's doctor about that. Also, Cerenia is good just as an anti-vomiting medication for certain medical conditions as well.
I use it almost exclusively in my hospitalized patients.
Yeah, it works really, really well. So good thing. And I also like the fact that the folks put together a little travel checklist. So we'll take a minute to just kind of review over that. And certainly we thought of some of these same things with traveling with Mr. Butters. But if you are planning holiday travel with your pets or travel into the new year, you do want to make sure to have your pet checked by the veterinarian to make sure that he or she is travel ready. Generally, very old pets sometimes don't do well with the transition of travel, and sometimes the rigor of travel can be difficult for them. Also, very nervous or high-strung pets may not do as well with traveling. So you want to make sure that your pet's super healthy and fit to travel. You want to have a health certificate. And I will say, depending on the airline, depending on the personnel at that airline, they may or may not ask you for that health certificate from your veterinarian.
That's what happened to you last week.
Yeah, that's
right?
what happened to me. We had it all ready to go, and nobody asked for it. But I sure
Don't
wouldn't
count on that.
Yes, I sure wouldn't want to get there and have that be the part that holds up my travel.
Right.
Also, you want to have proof of rabies vaccination, so that if there's any question about that, you're covered with a certificate that says your pet is licensed and legal to travel. You also want to have any other necessary documentation. I know we talked just last week at the office about all of the international travel we're seeing. And so depending on where you're going, there may be specific requirements relative to rabies titers or certain immunization schedules, or that those vaccines are done at set intervals prior to travel. So there are a lot of very specific requirements with international travel, and where you wind up on the other end definitely will determine what those requirements are. And we'll talk more about that. Maybe we can visit with the air animal folks at some point.
That's right. They do. There are services or companies you can contact that will get you a list of the most up-to-date requirements and needs for going to Japan, China, whatever country you pick, and they'll be able to actually guide you probably better than we can.
Right, because those requirements sometimes are changing too.
Very often.
So, absolutely. So, any necessary documentation from your veterinarian or relative to wherever you're winding up going internationally. Also, you want to make sure you have food and water bowls. And I found some really great water bowls that were collapsible to where they just folded up. They slid in underneath the little pad in the carrier to where we were portable and ready to go. So having food, having water, bed, crate, even a first aid kit is a good idea. And then some waste bags. And those can be truly little poop bags like you get from a little dispenser at the pet store, or we just brought trash bags. We just compressed down some trash bags again, stuck them under the little mat in the carrier, and we were good to go. Also, having a dog seat belt or car carrier is a great idea. You might want to bring some Cerenia along if needed, a leash and a collar, and veterinary contact information. And one of the things on this list that I really liked that I didn't think of, and granted we would have been covered for this anyway because we've got pictures of Mr. Butters everywhere on all of our phones, but travel with a picture of your pet, because if God forbid something happened and your pet did get away from you in an airport or outside of the car, I mean, the first thing you'd want to have is a picture of that pet. And we hear that a lot too, that people don't have pictures of their pets, and then when they wind up missing, there's not a good way to show people what that pet looked like, because a brown dog, a black dog, that could look a lot of different ways to a lot of different people. And then last but not least, make sure that your pet has proper identification and a microchip, because without proper identification, 90% of pets don't get home, and 1 in 3 pets gets lost at some point over their lifetime. So you definitely don't want to have that happen on a trip.
Way easier to just have the tag, have the microchip. Yep.
Absolutely. They really do work.
Yeah. Hopefully we're avoiding that problem of not having pictures with everyone taking selfies of their dogs now. And
absolutely.
So it's a lot worse than or a lot better than it used to be.
Yes, much less trouble that way than times past. But, even recently there was a case that I was familiar with a dog that was a very important part of a family, and they just didn't have good pictures of this dog when something happened and he got lost. So anyway,
Sure,
never take that for granted.
No,
yes,
heartbreaker.
but the dog got home, so it wound up okay. But
good news.
yeah, but didn't have those pictures, darn it. So, well, what else is on your mind today, Dr. McCauley?
Well, I always love the fun animal news. This is actually a big, it may not seem like a very fun or laughable story, but it actually is very important in terms of both animal health and human health. Researchers at NYU Langone Medical Center actually have published a report yesterday saying that they have developed a vaccination to protect deer from mad cow disease, or what's actually called chronic wasting disease, which is, you may have heard of it, spread in England. So mad cow disease spread there. And this is a disease caused by a prion, which is actually it's smaller than a virus even. It's just a single or maybe a clump of proteins that actually cause this deformation of other proteins in the brain normally. So it's actually can cause a type of disease that it doesn't exactly pit well with it, but it looks like mad cow disease in humans. It's called Creutzfeldt-Jakob disease. It actually is a fatal disease that can be caused by this. It can be spread by wildlife or cows that have this. And so it's a big deal that these researchers have discovered this vaccine that protects deer and wildlife, wild ruminants, from developing this chronic wasting disease.
Wow. Now, will it work in cattle, or has there been information released about that so far?
This doesn't state cattle. This is more along protecting the wildlife. I think the big thing with controlling it in cattle is identifying it and removing those cows from the food chain. Exactly.
Right.
This is, you can imagine if the disease gets out to the wildlife, it's going to be a whole lot harder to test deer for this disease as it would, cows. And so
now, is this going to be a vaccine that works in a bait drop fashion, or does the new research reveal that at this point?
They didn't say how it was administered. I would imagine it would be at this point an injectable one on control animals, but that may be hard to pull off with wild deer again. So
and it may be something where it starts as an injectable and goes to a bait drop sort of vaccine, which that's one of the ways that rabies vaccination is done in wildlife.
Yes.
So that's exciting.
Yeah. So I think they may follow that model as well. So
very big deal.
Exactly. Not laughable haha news, but very important news, and this kind of idea of One Health, which we may not have mentioned on the show before, but there is a kind of a mindset called One Health, where we kind of try to have overlap in the veterinary health and human health worlds to benefit both areas.
Well, I've always thought comparative medicine was so fascinating because, and as veterinarians, I feel like as we control the health of pets, we are protecting families, whether we're talking about leptospirosis or parasites and those sort of things, because there are a lot of parasites that can transmit between pets and people, and it's a matter of knowledge and education and, once again, prevention to keep both pets and families safe.
Yeah, so just another step
big
in
news.
That. Yeah,
that's
absolutely.
great. Okay, well, any other news topics that are as great as that? I don't think you can top that very much.
Yeah, no more news. I do have a little teaser for our next show. Some of you may have thought that our shows have been a little dog-centric recently, so I am actually going to talk about two very common feline diseases in our next show, FELV, or feline leukemia virus, and FIV, feline immunodeficiency virus.
Great. Those are a couple of very important topics, a lot of misinformation about both of those, and so it'll be great to kind of talk about those, update some information, and set aside a few myths and some confusing information about that. So that's great.
So all you cat lovers, be sure to tune in next week. We'll have a lot of really good information on a disease that that is very controllable with vaccines, but we don't see as much vaccination as we need.
Right, indeed. Well, and speaking of vaccines and controlling diseases, I'd like to take just a moment to talk a little bit about Parvovirus. And in fact, we've been following Sandy and her puppies, and actually we had a positive situation with Parvo show up in Sandy's puppies. And, this is, of course, very worrisome at this point, though, related to early detection and some very astute nurses being on top of a little spit-up episode that was observed with a puppy. The testing was done and a positive was found, but thank goodness, and we'll check in with the puppies in just a moment here, but the puppies are all doing well, they're thriving, but having that diagnosis early and knowing that it's there will allow us to address the problem much sooner. But parvovirus is a contagious virus of dogs, and we presume that this exposure with Sandy and her puppies was probably something that happened prior to her coming into the orphanage, but it is something that can be spread with just casual handling dog to dog, or it can be in contaminated soil, and it's one of the puppyhood problems that we vaccinate against. And of course, with Sandy's puppies being so very, very young, they're not even of an age to be vaccinated yet, and we were hoping that the mom perhaps had a little more maternal antibody, but evidently not. And again, as a stray, that's a risk that we see. But by doing parvovirus vaccinations for dogs, we can literally almost prevent this disease or reduce the severity of the condition when we see it. And parvovirus is a virus that attacks the intestinal lining. It's one that can cause quite a big damage in the little folds and villi, the little corrugated surface of the intestinal lining. And when that happens, those surfaces become raw and irritated, and the dogs will present with either anorexia, vomiting, or as the condition really progresses, into a bloody diarrhea. And then secondarily, bacterial infections set in. That bacteria that sets in really just wreaks havoc with the intestinal tract. And generally, it's the bacterial infection secondarily that winds up being the cause for these little puppies to die. So again, with early detection, hopefully everything will go beautifully. And as we'll see in a moment, the puppies are doing well, they're thriving, and hopefully in another few days of supportive care we'll be past the scare. But early detection is always best, and vaccination as soon as puppies are old enough, which is between the 6 and 8 week mark, is so very critical. And what would you advise pet owners to do relative to parvo? What do you usually like to tell folks?
So I tell them that the parvovirus, it is present in the environment in some amount, but it's in larger concentration in areas where there's lots of dogs. So don't be taking a 3-week-old puppy to the dog park, or especially any non-vaccinated animal to the dog park. It's a disease that can be treated, but again, it's way better to be prevented, because we do see it a lot more in puppies who don't have a fully functioning immune system. They're very small and don't have a lot of energy reserves to come back from this really, really tough disease. They become dehydrated really quickly. So it's a huge burden to try to treat these animals, and the disease can be very deadly. And so I always say, quarantine that puppy as if it's going to get parvo, because if you take it out to an area where there's a lot of other dogs around, or just very common areas, it's likely going to get it if it's not vaccinated.
And I like to be super, super cautious with certain breeds. Rottweilers, German Shepherds apparently have a little weakness in their immune system that makes them more prone to succumbing to the parvovirus. So if in doubt, talk to your pet's doctor about that. And generally the vaccine schedule we like to use for puppies is where we see them for the first time between 6 and 8 weeks, have a booster shot at that point, and then typically roughly 4 weeks later, another booster, 4 weeks later again, another booster. And then there is a school of thought that reboostering somewhere between the 8 and 9 month point, or 8 to 10 months of age, especially for breeds that are more susceptible, if not all, really helps to boost that immune system up. I had a dog actually when I was in vet school that wound up getting parvo after he had been through all the puppyhood stuff, but he was right in that window, probably at about 7 months of age, and he got the parvovirus. Lucky thing I was a vet student, I was alerted to the risks of parvovirus and had the best possible care at Texas A&M University, and he made it through. He was one of the lucky ones, but it was a rough road for him. But it was one of those situations where I know probably where he was exposed. It was out at a community park at an event, and he probably got exposed right after he was vaccinated fully, but not fully immunocompetent. So again, as always, if you do have questions, we recommend that you talk to your veterinarian. If you have questions for us, you can always reach us at podcast@welovepets.net, or if you want to give us a call, we do have a number you can call and leave us a voicemail, 972-808-6038. And of course, don't forget to subscribe.
Always subscribe. Exactly. If you want to do it through iTunes, again, we're newly on there, so you can find the link below this in the description, or you can just go into the iTunes store and search for Eastlake Pet Talk Podcast.
Very good. And I'm going to say, why don't we take a break and switch over to Sandy and her puppies right now, and close out the show that way today.
Sounds good. Who love puppies? Yep.
Indeed. Good way to close the show. Right. So thanks so much, and we'll see you in just a bit. Before we step outside to take a moment to visit with Sandy and her puppies for an update, I'd like to first introduce you to Jet. And Jet is our pet of the week. And here he is, sweet little Jet. He's really a great cat, but poor little Jet has been with the Eastlake Pet Orphanage since he was a kitten. And sadly, Jet is just one of the black cats that are in shelters everywhere that get passed by. I think people are sometimes superstitious about black cats, and also we see that more black cats are actually born due to the dominant hair color that Jet has here, being a black cat. But he's a sweet boy, sensitive little kitty, and just needs a home and needs a chance. So if you'd like to give Jet a chance and a home, definitely let us know at East Lake Pet Orphanage. We're happy to introduce you, and this is a great little boy, sweet, sensitive kitty cat. And just remember, black is beautiful. Okay, as you can see, Sandy's puppies have grown up quite a bit, and they're pretty active and playing and romping and having a great time. So they just turned 4 weeks old yesterday, and so they are on the move, as you can tell, and having lots of fun with each other. They've started to bark and talk and howl and really play quite a bit, and they love being outside now and love just having a good time with each other. So here they are, all of Sandy's babies, all 10 of them, 5 boys and 5 girls, and they're going to be ready for new homes in just 2 weeks. And so pretty soon they'll be ready to go. Oh gosh, pretty big also. Thanks so much for joining us here on the East Lake Pet Talk podcast, and we'll be back next week with more information and more news celebrating pets. Thanks so much.